Welcome everyone to the Understanding School-Based Mental Health and Medicaid webinar series. This five-part series is designed to build a shared foundation of understanding how Medicaid supports mental health services in both school-based and community-based settings across the state of Illinois. The vision of this series is to support the provision of mental health services to students within school settings to reach all youth, and especially those that may be most vulnerable that cannot access services otherwise. My name is Matt Buckman. I'm a licensed clinical psychologist, duly credentialed as a school psychologist, and also the executive director of the Stress and Trauma Treatment Center. I will be guiding you through today's content and this five-part series. This webinar was developed with support from the U.S. Department of Education's School-Based Mental Health Services Grant awarded to West 40 Intermediate Service Center No. 2 in partnership with the Stress and Trauma Treatment Center. This material is provided for educational purposes as a broad overview. It does not replace the official guidance from HHS, CMS, or the Illinois Department of Healthcare and Family Services. Regulations and compliance requirements can change, and participants should always consult authoritative sources. This is a five-part series. This series progresses from foundational Medicaid concepts to increasingly more specific applications. Starting with a foundational understanding of Medicaid allows us to dive deeper into the school-based reimbursement system, community mental health services system and reimbursement for this, and specialized care coordination service organization and pathways programs. The final part of this series will be a discussion of ideas for action, which will build on the previous content and identify concrete steps or strategies to leverage funding to increase access to mental health services for students. Part 4, an overview of care coordination service organizations and pathways to success services. During this part, I'm going to talk about the benefits of community partnerships, especially for our highest need youth with mental health or psychiatric needs. We're going to talk about the Family Support Program and residential treatment services, care coordination service organizations or CCSOs, and wraparound and care coordination or intensive care coordination. Talk about CCSOs and pathways to success providers and the service types that are available, and leave you with some useful resources in case you want to dig a little bit deeper to be able to see about our highest need youth getting the services that may be necessary. When we're looking at our community partners, there is that inverse relationship between the capacity, resources, and focus or reimbursement, even priority for our tier 3 students more than our school district. So oftentimes we're not going to see a lot of preventative services, some early intervention, community-based services, but then a lot in our individualized supports and even more into the intensive supports for individuals with the highest need of services for mental health and psychiatric care. HFS reports this current continuum of care for children, looking at the small amount of prevention, community-based services, intensive community-based services, crisis services, and inpatient services. HFS reports that they get about 100,000 crisis calls to the CARES line. The CARES line, hopefully everybody's familiar with, which is what we're going to call for anyone with Medicaid to be able to get them screened to determine the next step for psychiatric or homicidal or suicidal risk that may present itself during the school day. Of those 100,000 or more crisis calls, 35 to 40,000 of those result in a crisis screening. And that's when a person or a provider actually comes out to the school or to the home or to the community setting. Within that, about 40 to 45% of those screenings end up with hospitalization as what occurs after that. That could be an inpatient hospitalization. That could be 1 to 3 days or 7 to 14 days, really varying based on the needs of the individual and how they do within the hospital setting. HFS reports that those psychiatric hospitalizations cost about $140 million, and that's going to be for a small percentage of our youth that need that level of care. while the larger percentage of our youth that are receiving mental health services through children's community-based services is about $90 million. So very much the state of Illinois and a lot of the programming that is being rolled out, this programming is trying to create more stabilization within communities and provide more intensive community-based supports so that youth do not end up having to be hospitalized or end up in residential treatment care. We visited this before, but here's the mobile crisis response process flow. And so, what we should be able to do is call the CARES hotline. Within that, some type of referral to whoever a CARES provider is or a crisis provider is should happen in 30 minutes or less. And then the mobile crisis response team member or team should provide a face to face response within 90 minutes with the individual. During that time, many times we're providing a Medicaid reimbursable service as we're providing supports to those individuals and we're supervising those individuals to make sure they're safe from harm to themselves or harm to others. The provider will come out and provide or conduct an assessment and screening using the IMCAT, which is the Illinois Medicaid Crisis Assessment Tool. The IMCAT will then determine or have cutoffs with the provider, with the family involved, around whether or not institutional treatment like psychiatric hospitalization or some other kind of stabilization or community stabilization would be possible. Oftentimes in our system, we are working towards community stabilization anytime possible. Now, over time, with enough crisis calls or the inability to be able to stabilize in the community, given the needs of the individual, the capacity, the availability of resources within the family, within the home, within the community, there is consideration of whether or not entry into the family support program occurs. This is formally known as the Individual Care Grant or ICG. Youth are enrolled for 180 days within that program, and then there can be extensions of that program, and there are extra supports and services that are available through a coordinator that is there with a small caseload of individuals focusing on the needs of the families that have experienced multiple hospitalizations or very significant psychiatric or mental health needs for the students or the youth that are involved. Care coordination would be provided by the care coordinator for the family service program. That will include identification of the needs and the strengths and the services. Will complete an Illinois Medicaid comprehensive assessment of needs and strengths, do an integrated assessment and treatment plan, and coordinate services to be able to improve the outcomes for the student. Family support services, including therapeutic supports, which can be a purchase of services, such as equine therapy or some kind of specialized type of treatment or support that could be there that typically we're not going to see as a Medicaid reimbursable service or support. And then individual supports like summer camps and gym membership, et cetera, that typically we're not going to see Medicaid reimburse for those things, but will reimburse within the family support program or family support services. And then when there's not enough community stabilization and there is an open bed or open room available within a residential treatment program that's an appropriate level of care for the youth, residential treatment is also provided through the family support program. That residential treatment is not hospitalization. It is a more longer term or long-term care support for only the highest need level of care. The benefits, the goals of this are to strengthen family stability, promote community-based services, and try to create kind of flexible funding to be able to create services or supports that can stabilize an individual. We want to improve and promote the clinical outcomes and functional improvements for our youth and make meaningful impacts in the system of care so that things are aligned and extra supports and extra pathways and barriers are reduced and things like that for the youth in these high needs programs. Pathways to Success is another program for high need youth that are experiencing significant or extreme mental health symptoms or psychiatric disorders. This program has evolved from SAS and earlier wraparound systems, and specifically is focused on youth with significant behavioral health needs who may require multi-system support. So it may be that there's challenges at school, and there's also in child welfare or DCFS, and there's also challenges within the community setting, within the home setting. So when we're looking at multiple sectors, multiple systems that families may be involved in, because of the behavioral health needs, this is what Pathways to Success is developed for. The emphasis is using a system of care framework where we're looking at how do we create family-driven care so that the family is in the driver's seat of this, and we're tailoring services and supports to them using a strengths-based planning and process approach, having child and family teams coordinating together that have around 50% or so of natural resources and natural supports. And we're integrating this cross-sector solution when we're looking at lots of different systems that families are having to navigate. And we're looking at this family and friends as like the close ecological system. And then as we're broadening that out, depending on every family, we may see primary care, or maybe probation, or the justice services, or child welfare and DCFS, maybe a caseworker or intact worker, maybe faith-based services or supports, if that's a part of who they are, recreational programming and services, if sports or certain types of things are important to them, substance use services, if that's involved in this, and of course, educational services and supports. As we're looking at this, the goal is to create a child and family team and child and family approach that helps families navigate and aligns all of these services and supports so that we're all moving towards the same goals. So that comes from the Care Coordination Service Organization, the Care Coordination Support Services. There's also family peer support services that are available, intensive home-based services, respite services for those who are interested in that, therapeutic mentoring, therapeutic support services, and individual support services available to those individuals. For eligibility, one of the main ways to be able to do that is to complete the IMCANS, the Illinois Medicaid Comprehensive Assessment of Needs and Strengths. So any community behavioral health provider that is a Medicaid certified provider can complete this tool, and the responses on this tool create a stratification or a tiered approach at the state level and determines who's eligible for pathway services. And then the Care Coordination Service Organization works to do outreach to try to engage those families in services based on that eligibility or that determination at the state level. Families can also go through a request for consideration of this, and there's an application process that is available, but you have to have the IMCANS completed to be able to do so. The decision support criteria is utilized at the state level, and there's different tiers. And so if it's tier 1, then wraparound services, specifically high fidelity wraparound, is considered the level of need. Whereas if it's tier 2, care coordination or intensive care coordination is considered the need level. But these notifications do occur. It also will result in a letter to the family that says you are eligible for these particular services. And then that extra package of supports and services are now available for a short amount of time to that individual. Usually it's about a 6-month eligibility period, but that eligibility period does start as the notification occurs. The Care Coordination Service Organization provides certain supports, while a Pathways community-based service organization will provide the additional supports. And so there's typically two organizations that are going to be involved in the care for that youth and that family when that highest need level arises. So when we're looking at family peer support services, these are designed to provide support from peers that have family members with mental health concerns or psychiatric disorders, that they can provide coaching and support using their lived experience to support family members as they're navigating systems, as they're coping with the challenges that come with having a child with complex mental health needs or serious emotional disturbances. Intensive home-based services are also available. These are short-term team-based services. They are using evidence-based treatments, both managing and adaptive practices and solution-focused therapy. The goal of these are to be able to provide intensive supports at least 2 times a week, using intensive home-based clinical and home-based support services. So there's two different providers within one organization that's providing that particular service. This intensive service is used to provide caregiver supports and the child supports or the youth supports or student supports. And we're going to increase child and family functioning, promote some of that healthy functioning, improve the ability or capacity for the family to be able to support the child. Or we can also provide supports within schools, so that those provision of services within schools to help teachers and other school staff cope with the behaviors of high needs youth, and to know how to coach and support that youth during psychiatric crises, or during times that their symptoms are affecting their functioning at school. IHB services, intensive home-based services, will start with a functional behavioral assessment. And in that functional behavioral assessment, the goal is to link in the behavioral needs of the youth with specific interventions that can help address those particular needs. These are always supervised by licensed professionals of healing arts or licensed clinical providers in mental health. And then support services are working under the clinical treatment plan, and those support services can provide additional coaching of skills and helping families implement certain things, or siblings implement certain things, or school staff or after school program staff implement certain things that help the students be successful. Intensive home-based, just like care coordination, these are provided with limited caseloads. So the goal is that any intensive home-based provider is not, the team lead is not providing more than leadership in more than 6 to 8 cases. So our goal is to not have where it's a vast majority of clients are receiving this service, but instead they get targeted supports with capacity that is able to address the intensive needs of that particular youth. IHB service delivery, using the team-based approach with highly clinically and well-trained individuals providing evidence-based treatments, things that we know work. Those services are provided at times and locations that are convenient to the family. That can be in the school, that can be at their home, that can be after school programs, that can be at the public library, at the park, anywhere it needs to be. That those services can be provided. They're provided over the face to face. They can be telehealth services that schools can utilize, even if you don't have a community provider that is co-located or integrated within the school, that these youth can get additional services and supports that maybe could not be available otherwise, or supports that you find yourself exhausting the capacity of the team that you have within the district, that this can supplement some of those supports and services. There are 2 hours of services that are provided each week, and that's the minimum amount of services that are being provided each week. And those are in coordination with the child and family team and recommendations that are happening there. These services do happen for 3 to 6 months, so it's not a forever long-term type of service. But these services will happen, and will continue to occur for the students that need these services. Some of the responsibilities of those providers include crisis prevention and crisis response. So, working with youth around and families and system partners and schools and staff members around de escalation techniques and strategies to be able to help youth cope when they find themselves in crises. Of course, the mobile crisis response team is still able to provide supports, but intensive home based providers, within 48 hours after any crisis that occurs, will participate in any of those meetings that are put together for child and family team responses to the crises. And the goal is to utilize community based supports as much as possible to help youth and families be successful. Uh, this approach does use a solution focused approach as well, and it helps customers develop a vision of their future and help students and families be able to think about how we've solved things before and how can we solve them in the future, and utilize tools and resources that are at their fingertips or that they've used in other situations to help implement a natural response that can be therapeutic and healing for the family. As I mentioned before, MAP, or Managing and Adapting Practices, which is a common elements approach, will utilize a distilled version of what are all the effective treatments out there and how do we utilize those effective treatments in the services of our youth. So we're not doing treatment as usual or traditional services as usual, but instead we're trying to tailor evidence-based approaches using MAP tools to be able to create effective change and monitor and measure that change over time as well. In a typical service week, we may see individual family or parent interventions. In the school district, we may not even see the provider in that because maybe they're working primarily with the parent on how to intervene and how to cope with that, how to provide the appropriate supports for the youth or create the capacity that's needed to be able to help the youth cope with the psychiatric or mental health challenges that they might have. It'd be cross-system interventions, so we'll see them in the school, we'll see them outside the school, but any given week, we're not real sure where that might be because it needs to be wherever the most symptoms show up. Now, if most of the symptoms show up in the school, we should be seeing those providers in the school on a regular basis and available if crises do occur. The immediate mobile crisis response is still the way to go for immediate needs. However, if that person is available in the school or is integrated in the school, we do want to see response to that, or even telehealth responses and safety planning and crisis prevention planning as much as possible. Respite is another service that oftentimes families will benefit from. When we get to some of our highest need youth, it can be pretty exhausting to both educate as well as raise those individuals. And so their symptomology can oftentimes drive wedges or exhaust caregivers and educators and others that are trying to provide supports to them and trying to help them cope with those psychiatric or mental health challenges. Respite can be available for up to 21 hours a month, 7 hours, up to 7 hours per event, a maximum of 200 hours throughout the year. Respite supports can be provided in a community center, at the park, and recreation can be provided after school, can be provided during school hours, can be provided in the home. There's not a lot of there's not really high requirements for who can provide respite. A caring adult can do so. Sometimes respite is an interactive time, and sometimes it's not an interactive time. Sometimes youth are just exhausted and need a safe place to sleep or relax. And that's what respite ends up being for them. And sometimes it might be more interactive, more strengths based, and doing something that is important to them. Maybe it's throwing a football or what we might consider like mentoring types of things if it's not a specific skill. If it's a specific skill, we're actually going to be looking at therapeutic mentoring that is available to youth. This is about building strengths. So, if a youth is pretty good at basketball, and that's what can be a nice distraction for that youth, or that helps build a strength that then can counter some of the symptoms that of their mental health challenges, then that might be an area to go. Oftentimes, we're focusing on pro-social, appropriate behaviors, social skills development in the home, school, community settings. These individuals can model the behaviors, can explicitly train on the behaviors, such as social skills of how to greet, how to accept no, how to problem solve and make good choices. Many times, the things we're going to see in our schools that are social emotional learning skills, we're going to see therapeutic mentors being able to do that one on one with our youth, and with the youth that will need supplemental types of supports because of their intense need, or high risk that might be there. So, what does success look like in the family support program, in the wraparound and pathways to success program? It results in improved family functioning and reduced caregiver stress. It results in improved school attendance, improved performance at school, more stable living situations with fewer out of home treatment episodes or placements outside the home, or instability from home to home, or homelessness, or being kicked out or locked out or running away. Increase family and youth involvement in services, reduce contact with DCFS and law enforcement, and increased use of effective practices so that we're not only providing a higher dosage, but we're improving the quality of services that are available and being utilized by families. There are important resources if you need to explore more of that, but stay tuned. Our final part of our series is ideas for action, increasing mental health services for students in Illinois. This is going to be the compilation of all of the ideas of how we can increase services and get more mental health services within our schools, within our district, or to the children and families that we serve. I'll see you at